Alright, 10 general rules for dental sutures. Hopefully you will enjoy this video and you will learn something from this video. Here are 10 rules. I'm going to tackle one by one with the illustration that have been drawn by Dr. Sung. Alright, number 1. Place a suture primarily at the distal of the terminal tooth. It is a very basic one. Just to begin from the end area, okay? Distal area for better visualization, better better approximation. But it is sometimes time. Like if you want to begin from front, it doesn't matter, okay? But it is general rule that if you follow it, it is better. It is easier because if you do the um, ties or suture from the front, okay, here are some knots there, and it might be like disturbing you. But if you do from the back area, of course, if you do more difficult thing first, then it gets easier and the better visualization, and assistant needs to cut at the end the thread, right? But if you end up, you know, um, doing the last knots at the end, then assistant uh, will be having more difficult time. If you want your assistant to suffer, then it doesn't matter. But why would you make your assistant and yourself suffer like in the difficult time while like during the suture time, All right. So number 2, always passes through the more mobile tissue first. Sometimes, you know, I poke the I do the puncture first, attach the gum first, and then I try to hook the mobile one after I easily pass the attached one, and try to um, pass the needle through the mobile one. I had a hard time, and if I if I studied well and remember this during the time, I do not hook the attached one first, and I do to make it more uh, much easier. So don't be like me. Um, attached one, don't hook it first, okay? Always hook the mobile one or more mobile, okay? More mobile one, and then do the attached one so that you will have a much easier suturing time. Okay. Okay. Third, because intraoral space is limited, use a curved needle. Of course, like these days we use only curved needle, right? We don't use like straight needle. That is ancient time, because if you use straight needle, you might poke the cheek, you might poke the tongue, and you will suffer a lot. So number 4, hold the needle with needle holder. Yeah, I also have tried to use the pinset or the cotton plier to manipulate the needle, maneuver the needle, but it is very challenging. It is like, why do you suffer? Okay, let's go easier way. Let's use the needle holder, as it has a needle as it means. Okay, needle holder. Use needle holder. Using the hemostat is also kind of okay, but it is not as comfortable as needle holder. As you can see, needle holder has this um, like cross diagonal grip, okay, that enables you to hold needle in a various angle. But hemostat, as you know, it has only single shreds grip, so you can only hold a needle in a perpendicular way, right? So when you are reaching further back, it will be challenging. So don't suffer, use the right instrument, make yourself and also the patient easy. So number 5, with the holder, grip the middle third of the needle. So you might, if you are beginning, probably you might think where to hold the needle, right? Should I hold the front area for me to give some more strength, or give a perpendicular penetration? No. Should I hold the end so that at once I can hook everything up? No. You need to hold the middle third. The reason why it is not recommended to hold the um, end, the stressed area, is that there is a chance that you might damage this joint between the needle and the thread, and you might end up dislodging the thread from the needle. If you hold the front area, there is not enough penetration. It'll take longer time for you to penetrate the whole needle inside. So if you are questioning yourself where to hold, the middle area is a good area to hold. So this is the example that it has the stretched area. So if you hold this area, there is a chance that you might disassemble them. All right. All right, number 6, enter soft tissue at 90 degree. Oh, perpendicular to the surface. So this is the perpendicular. So go like that, okay? Penetrate it perpendicular. From first, which surface? This one or this one? Of course, number 2, mobile tissue first. More mobile to make your life easier, right? So hold the mobile flappy tissue and perpendicularly, because if you compare these two needles, let's say first needle is this and the second needle is going that way, let's pick it as a blue. Okay, second needle, which has a more surface that are injured. Okay, so the first tissue just injured this much, and the second tissue got injured with the orange this much. Wow. So less trauma, better outcome, better healing, right? So number 2 damages or traumatize the tissue more than number 1. So that's why it is recommended to go through the shortcut. Okay, you don't want to run more, so shortcut. But sometimes it is not possible when you are going through attached tissue or something very firm, right? That way I just violate the rule, okay? But if you relieve this tissue, if you relieve this tissue and make it floppy, like less mobile, like this, then you can probably do the 90 degree. It is a recommendation, okay? So place the knot as buccal as possible. I like this rule. And if you place the knot, okay, first lingually, what will happen? And now you are putting your patient in trouble. Like they will play with the knot whole time. Do you know how it is annoying to have knot on the lingual side? It is rubbing against the tongue. The patient is curious with the tongue. Whenever you do the scaling on the patient, especially the lower anterior, the patient is always pushing his or her tongue against the lingual side to check what we are doing, what dentists are, cleaning. So, in the same way, if you place the knot there, the patient will day and night play with the knots and loosening them and or scratching their tongue. We don't want that to happen, right? Do you want your suture to be loosened after you tie it so nicely, right? We don't want that to happen. How about on top of the uh, incision line? Let's say you place the knot on top of the incision line. That is the number 2. Okay. Then, do you know, have you seen silk knot or any knot that has been stayed in patient's mouth for 2 weeks or 1 week? You will see some tangled bacteria and plague around the suture knot, right? Yeah, we don't want that to be on top of the incision line, causing infection, right? And delay the healing. We don't want that to happen. So after tying the knot, if you just push it towards the buccal area, okay? Push it away from the tongue and incision line. That is the recommendation, but it is not something that you need to must. But if you are thinking of your patient and also the thinking about the healing, push it towards the buccal if possible. Okay. Palatal area is as well. Okay. Push the knot buccally. Do not compromise flap blood supply. Flap blood supply. Okay. Blood or perfusion. It is a very, very, very important concept as a dentist. We don't want your flap to die, right? Go necrosis. Um, Jesus also said blood is life. So let's say if you are opening this flap, okay, you need to open it like this, which means the base, this is the base, needs to be wider than apex, right? Base needs to be wider than apex. But if you're opening this flap, sorry, one moment, let me delete it. This area, okay, like this, then your base is like equal or smaller than the apex. Okay, let's say if you're flapping like this, okay, then you are cutting off the blood supply, and you will end up losing this whole tissue, go necrosis. So always be reminded that whenever you make a vertical incision, it is must that you need to make a base wider, okay, base wider than the apex. And it is good to know that when you are giving vertical incision on the premolar area, you need to be aware of mental foramen, right? So if there is a mental foramen here, okay, about like at the apex area of the premolars, mandibular premolars, assume that there are some nerves coming up, okay, coming out. So we don't want to cut the nerves, so be conscious about it, okay, and be careful. This applies the same on the palatal area. So if you are making an incision without thinking, just like this, then you are cutting off all the blood supply which are coming from the great palatine foramen and the incisive foramen. So there are some cases that after doing the flap, the whole palatal area went necrosis, and there was a communication between the nose and the mouth. That is not good, right? So whenever you do the flap to do the odontectomy of the canine or something, always include the main blood supply. All right, number 9. It is pretty simple. Do not blanch, okay? If you kind of tie the flap hard, okay, then you will see some blanching. Then you need to loosen up a little bit. If you cannot loosen it up, just to cut the suture and do it again, even though you took time to tie it. Don't blanch it. Blood is life. All right, this is something. Um, it could be something new to you. It was new to me, and I think that it is a good idea. It is in the as a principle. I just knew that it should be 2 millimeters away from the edge, but the reason behind it is post-operative swelling can tear up the flap, and another reason that I also want to tell is that if you do it, if you puncture too close, okay, if you puncture too close, then there is a high chance that tear you can tear the tissue while you're um, suturing, right? So give a good room, two 2 to 3 millimeter. You can even make it like 5 millimeter. Doesn't matter, okay? Don't be stressed. Oh, it should be only 2 or 3 millimeters away. No, 5 millimeter, 1 millimeter doesn't matter as long as they are held together. But like you don't want to put extra materials unreasonably, right? There must be always reason in the RPD design. When you're designing, there must be always a reason. We don't want to put extra metal. We don't want to put extra stuff on the patient's mouth, right? So if you put them too close, there is a high chance that it'll be turn off, turn apart. So two, 3 millimeter or greater than that would be good enough for your tissue handling. At the same time, post-operative swelling prevention, swelling, tearing prevention. Okay, so just a good thickness from the edge, right, 2 to 3 millimeter or more. All right, those are the general rules for dental suture. Hope you have learned something, and let's do the recap. It has the old version, but I have combined them and made it into 10. So place the suture primarily at the distal or terminal tooth or area, and always pass through the more mobile tissue first. Okay, from my experience, I recommend it. And because intraoral space is limited, use curved needle, of course. Hold the needle only with the needle holder. It is very important. With the needle holder, grip the middle third. Okay, middle third. Never grasp the stretched joint. I combine it with the fifth one. Enter soft tissue at 90 degree. Better to do. Place the knot as buccal as possible. Very important. Do not compromise flap perfusion. Blood is life. The flap should not blanch, okay, during suturing, yes. And because post-operative swelling can tear, and also for um, better manipulation or preventing tearing the flap during the suturing, give enough thickness or the yeah, 2 to 3 millimeters away from the flap margin, okay, from the incision line, right, or even incision line or like flap margin, yeah, because when you extract a tooth, there is no incision line but flap margin. All right, so 10. All right, hope this video helped you. I'm gonna go to sleep. If you like the video, please watch the video next.
Thank you for watching Dr. Sung's dentistry video. Hope this video helps you and your support means a lot. Thank you.